Hello and welcome to today's webinar on integrated vector management with Syngenta towards malaria elimination. I'm your host, Nabir Tariq, Marketing Communications Manager at Syngenta, and I'm joined with my colleagues and speakers for today's session, Dr. Rose Peter, Mark Hoppe, Dr. Kai Sievert, Dr. David Zinyangiri, and also Howard Diallo, who is supporting me as the co-host. A big thank you to all of the attendees who have taken the time to join us today. We have a very interesting topic of discussion, and we hope you will not only learn something, but also enjoy the webinar. So before I introduce our speakers, I would like to set the webinar ground rules. This next slide. So all attendees are in mute and camera off settings. Syngenta as host will record the webinar via Zoom, and we will email the recording to attendees and publish it on our website, syngentappm.com, after the event. Recording by anyone else or by any other means is not permitted. If you have any questions, we've set the Zoom Q&A function so that you may do so privately by addressing your questions to the panelists only and not to everyone. If there are technical issues, please write them privately to Hava in the chat panel. And if you have any questions about Syngenta's data privacy practices, please see our privacy policy, which is available at syngentappm.com/privacy-statement. Now I will introduce our speakers for today. So first up, Dr. Rose Peter, who is a Bachelor of Zoology and Botany from the University of Cape Town, and also a Bachelor of Veterinary Science from the University of Pretoria. She has over 20 years of experience in vector control, and she was previously the Head of Research and Development in Sub-Saharan Africa, and is now Syngenta's Commercial Head of Vector Control for Sub-Saharan Africa. Also, we've got Mark Hoppe here with us today, who is a public health entomologist with over 30 years of experience in research, development, and advocacy in agricultural and insect control. He's involved in the development of novel solutions for the control of insects of public health importance. Mark is also the chair of IRAC's public health team, and he also co-chairs Rollback Malaria's VCWG's IVM and IRM work streams. Mark is also a fellow of the Royal Entomological Society. Also, we have Dr. Kai Sievert, who studied biology in Germany and has completed a PhD in virology. He's held different roles in the chemicals industry over 20 years and has been with Syngenta since 2014 as Technical Services Manager in Pest Management, Vector Control, and Farm Pest Control. Kai works in Europe, Africa, and Middle East region, and he is the Vice Chairman of RRAC. And last but not least, Dr. David Zinyangiri. He's an expert in malaria vector control with over 35 years of experience, both in public and private sectors. David's been instrumental in championing various vector control initiatives within the Sub-Saharan Africa region. His experience includes working with several public, private, and multilateral organizations, such as the WHO, FAO, and various USAID-funded programs. We're also joined with Howard Diallo, who's my co-host. She's currently in charge of the commercial and promotional activities in vector control for Syngenta's public health portfolio in West and Central Africa. She's based in Senegal and has over 10 years of experience in the region. So thank you to all of the speakers for joining us today and for sharing their expertise in this webinar. The agenda for today is as follows. So Mark will start off with an introduction to IVM, and then David will talk about Syngenta's contribution. Kai will share his expertise on larvicides and adulticides, and then we'll go back to David for insight into waste management, education, and community engagement. Rose and Mark will discuss strategic thinking on malaria control. And finally, towards the end of the webinar, we'll have a Q&A and open discussions on any questions that attendees may have. So when the speakers are talking about their topics, if you do have any questions, let us know via the Q&A function below, and we will answer those questions at the end. So without further ado, let's start off our discussion with Mark Hoppe. So Mark, can you please explain to us what integrated vector management is and why we should be thinking about it?
Okay, thank you very much, Nabir. Good afternoon, everyone. So IVM, Integrated Vector Management. So what is it? Well, the World Health Organization have a very specific definition, and they define it as a rational decision-making process for the optimal use of resources for vector control. And that's a very that nicely encapsulates IVM. But a lot of other people think of IVM in a slightly more wider sense, and I think today we're going to be talking about it in a wider sense. And there's something which it can also be called integrated vector control, IVC, but together they're often just called IVM. And when we think about integrated vector control in the context of IVM, it means taking a more holistic view of mosquito vector control. So that might mean not just thinking about a single intervention, not just thinking about IRS and then we've done vector control, or not just distribution of nets and we can think about something else. It's taking all the actions and activities we can that will lower the population of mosquito vectors or minimize the interaction of those vectors and people, and that's the ultimate aim. So today we'll be thinking about IVM in a slightly wider sense than the strict WHO definition, and in a much more holistic way.
Fantastic, thank you, Mark. So what are some of the benefits of taking an integrated approach to vector management?
Well, I've mentioned it's not just about taking one approach. So you can undertake a program of IRS, so indoor residual spraying in a region, and that will be highly effective. But it's unlikely that it will completely stop interaction of people and mosquitoes. You may still have interaction with mosquitoes outdoors during the times when people are not indoors. So we need to think, well, what can we do to minimize those interactions or to minimize the mosquitoes that are present outside as well? And so it includes taking other or potentially taking other insecticide-based mosquito control interventions in locations where it's suitable so to do. Larviciding can be highly effective as well. It might, excuse me, it might involve aspects of education and training. It's about ensuring that taking the example of IRS, that excuse me, that the IRS is applied as well as possible so that we have the maximum effect and that we control the most mosquitoes as possible. But it's also education of the people living in the area that's being where the program's being undertaken as well. And it's about trying to remove the small water bodies where the mosquitoes can be breeding, because if we can remove many of them, there'll be fewer mosquitoes. So it's not just about, some people might think, well, IVM consists of, well, that means I have to do IRS and distribute nets. No, not necessarily at all. That's probably a very expensive way to do it, and you may have better end result if you were to look at some other options as well. So it's taking all the options we can, but thinking about it as in lowering the number of mosquitoes present and removing the interaction between people and mosquitoes, not simply making an insecticide application or giving out a net.
Thank you, Mark. You've mentioned it a little bit there. Is there a lot of financial investment necessary to implement a good IVM strategy?
Yes and no, I think, because yes, the more money they can be invested into a program, the more activities that can be undertaken, and the fewer, hopefully, the fewer mosquitoes there will be. But some activities actually have very little financial cost. So an education program to encourage the removal of rubbish or small bodies of water where mosquitoes breed, yes, you have to pay for the education program, but hopefully, that will have much longer term benefits. So it will have a beneficial impact and it won't have a huge cost. But going back to the WHO definition as well, an IVM is about the optimal use of resources. So it's about thinking exactly how and why are we making this intervention, and making sure that it's the one that will have the greatest impact on mosquito numbers and mosquito interaction with people, but also which is the best use of the resources that you have. Which is why the WHO definition encapsulates part of it so well.
Fantastic. Thank you so much, Mark, for introducing the topic. We'll go to David now to talk to us about Syngenta's contribution to IVM. So, David, when it comes to IVM, what is Syngenta's role in accordance with the WHO's IVM strategic framework, and also what is that framework?
Okay. Good afternoon to all our participants. Basically, when we look at the framework itself, as Mark has highlighted, the framework consists of 5 strategic pillars. If I can just name them, the one is advocacy, social mobilization, and legislation. The second one being collaboration with the health sector and with other sectors. And the third one, an integrated approach, which Mark spend a bit of time on that. And then the evidence-based decision-making is the 4th pillar, and capacity building. And now when you look at those 5 framework pillars, Syngenta has looked at that and also adopted the response framework in accordance with WHO and other partners to try and see where it can play a major role in terms of contributing towards IVM. And if you can move on to the next slide, I'll be able to highlight a few points based on that particular response framework.
Yep. Can you see that now, David?
I can see that now. So if you look at that response framework, you'll find that Syngenta's role in particular within that IVM framework is centered on a number of sections within those pillars, realizing that no one business or organization can do enough alone, and strongly support that the issue of the IVM framework, also moving towards the Sustainable Development Goal 17, which promotes partnerships between governments, the private sector, and the civil society. So you'll find that within that response framework, we're looking at engaging and mobilizing communities. Syngenta plays a major role in that. To talk about later. It also is involved in enhancing vector surveillance and monitoring and evaluation of interventions to make sure that whatever interventions we've come up with in our IVM program are interventions that are sustainable, effective, and cost rather, in order to come up with the eventual target we aim to achieve in our malaria, particularly in our malaria control programs. And then we also, as Syngenta, they are quite keen on scaling up and integrating tools and approaches. And in that particular scenario, there's a lot of innovative ideas that come up and are developed not only as Syngenta, but with partners, which will also enhances the opportunity of tapping in on various thought processes within different organizations. And then having looked at that, you find that in that top framework, which is part of our what we call pillars of action, we also look at enabling factors. We, as Syngenta, we may have anything to do country leadership in who is the leader, but what we are there to do is to support whatever leadership is there in order to enhance the IVM principles that may be adopted by each country, because these IVM principles may not be the same globally, but the general principles may be the same, but individual amongst countries, different strategies may be adopted. So you'll find that Syngenta is there to support that country leadership to achieve those particular strategic initiatives to ensure a good IVM platform. We also are involved heavily as Syngenta in advocacy for resource mobilization and partner coordination, where we are open to be of assistance in whatever programs we are involved in. But having looked at that whole top section, you'll find that there is a strong foundation required for IVM to succeed. And that foundation involves the enhancement of vector control capacity and capability. If programs are not well capacitated, you find that their success is not up to the levels expected. So it's important from a Syngenta perspective that where we can capacitate in terms of training, providing right technical know-how, assisting with a certain research expertise, Syngenta comes in that particular line of thought to enhance the capacity of programs. And also, we also tap in on the fact that according to WHO and its strong recommendation that industry or partners should be involved in research to research new technologies and new tools or new insecticides in order to counter the negative effects of insecticide tolerance, insecticide resistance, or acceptance, general acceptance from the communities that we want to assist with. So we also as Syngenta continuously upgrade ourselves, continuously engage ourselves in research and development to make sure that the tools that we come up with are appropriate for the time and for the interventions that relate to IVM.
Fantastic, thank you, David. So how has Syngenta's role impacted the malaria elimination agenda on a national, regional, and global level?
I'll start off from a national point of view, moving on to the global level. From a national point of view, we are actively active subscribers to the elimination agenda. However, we realize the challenges that programs do face in each and every country. So we work in accordance with the national plans to achieve their goals. And in that scenario, we make sure that whatever plans are adopted at a national level, we tap into them and we support them as much as possible. And mostly when it comes to developing the appropriate tools and provision of the right, for instance, we are providing chemicals, making sure that those chemicals or insecticides are available at the right time and at the right place, and being the right chemicals for that particular vector species within the national level. And from a regional level, we also reconcile our national activities with other countries within the region to make sure that we're not operating in one country in isolation to what the regional thought process is. So we make sure we tap into those, and we also sit on various technical committees to make sure that we're moving at the right place with all the technical expertise required within those regions. And on a global basis, in all countries that we operate in, we also participate in global fora, and we make sure that whatever we tap into at national, regional levels is brought forward to reconcile with what the global thinking process is as far as vector control or integrated vector management is concerned. And in that respect, we subscribe to most of the national or global programs in terms of technical meetings. We sit on those, we make sure that we contribute appropriately to make sure that we come up with solutions that enhance the IVM process.
Fantastic. Thank you so much, David. Now let's turn our attention to adulticides and larvicides, which of course is an essential aspect of IVM. So Kai, we'll go to you for this one. Okay, so on adulticides, before we go into any detail, can you explain to us what an adulticide is?
Well, as the name says, an adulticide kills the adults. The adults are the mosquitoes, which do suck the blood, which do transmit the malaria. There are also pupae and larvae, and of course eggs in the population, but the adulticide clearly kills the adults, either by IRS or by bed nets, in our case of malaria control.
And how about resistance in adulticides? Do you foresee a threat against organophosphates in the use of actelic?
Every insecticide can develop a resistance in insects. But the findings in Africa or globally are that our molecule, phosphomycin, the active ingredient of Actelic, is not very prone to develop resistance. But again, in theory, yes, even against our active ingredient, resistance can occur, and therefore rotation is key to avoid resistance development.
Thank you, Kai. And so when it comes to IRS, is it important to treat 100% of the huts?
Not really, of course not. If you treat 100%, you can be 100% sure that it works. But according to several studies, it seems to be 80% more than enough to control the mosquitoes. You have to think that they not only enter the hut and then sit there and then attack the people, but they fly around, they look for another place to rest. So in theory, and also according to several studies, 80% of coverage seems to be enough to control malaria mosquitoes.
I think. And so how about IRS on different materials? So is Actelic still long lasting when sprayed on metal roofs?
We have countless of studies showing that Actelic is long lasting on mud, on concrete, on wood. But indeed, there are not many studies on metal roofs, which can be, in the situation in Africa, can get quite hot. Therefore, we initiated a study in South Africa. And the most recent data we've just got is that it's fully active still after 6 months in the field. And we expect a longer residuality in the next months.
Fantastic. Thank you so much for that, Kai. Now we move on to larvicides. So again, Kai, just explain to us, first of all, what a larvicide is.
Well, again, it's similar to a adulticide. A larvicide kills the larvae.
Okay, fantastic. And is the mode of action of larvicides different to adulticides, such as pyrethroids and organophosphates?
Sometimes there are several larvicides registered or accepted by the WHO. And some of them are very different to adulticides, like the so-called BPUs, the benzylphenylureas, or pyriproxyfen. These are chemicals which interferes with the metabolism, with the chitin metabolism of the insect of the larvae, or acts like a juvenile hormone, the pyriproxyfen. Others, like for example timifos, but also Actelic 50EC, the organophosphate, act like an adulticide, but on the larval level. Larvae, of course, as everybody knows, do develop in water ponds and water bodies, and of course it has to be applied there, so a completely different way than an IRS treatment.
And is there a difference between larval source management and larviciding?
Well, according to the WHO, larval source management is much more than just a larvicide. Larval source management is habitat modification, habitat alteration, also the use of biological predators, for example. If you modify the habitat, it means really a really big impact on the structure. If you for example, you have to flush the system to remove the larvae, or well, the biological larviciding means you have to add, or you can add their little predators, for example, little fishes which eat the larvae. A larvicide is a chemical compound which is applied on the breeding sites of the larvae and interferes with the larvae and kills the larvae. So something completely different. And the larviciding is only a part of the larval source management.
And just a final question on larvicides. And so what are the challenges in applying larvicides?
The big challenge is there to find the breeding places, the water ponds, the water bodies, which is quite, at least easier in the dry season, especially at the end of the dry season when only a few water bodies remain. But in the rainy season, when every puddle, every tire, every grave waste can be the place where the larvae of the mosquitoes can breed, then it's basically impossible to treat everything. So therefore, it's really the recommendation to treat in the dry season. To look at the definition of the WHO, the larval breeding site should be findable and few.
Thank you very much, Kai. We're going to go back to David now. David, on the topic of waste management, what role does Syngenta play in mitigating the negative environmental impact within the IVM framework?
The frameworks within the IVM framework, Syngenta has developed a program which is part of its what we call ESG, or environmental safety, within the programs that we operate in, and that involves consulting at local, regional, and global levels with different players, coming up with our solutions. Those solutions in terms of waste management begin at the factory, where we start in the production cycle, ensuring that our production facilities are minimizing waste, and whatever waste we produce is disposed of as efficiently as possible. But having moved from the factory, we also moved to the client. The processes continue right from the factory right up to the end user. So in our programs, our focus, though, may look like we focus more on the end user in terms of the end use product, but the process begins right from the factory, where we manage waste right from there. But now our focus on the major activities that Syngenta is involved in at the end user level. At the end user level, the focus begins with training the end user in appropriate product use. Having trained the user on appropriate product use, we also train the user on product specs, the ups and downs of using the product in terms of its toxicology. And then we move on to the actual application of the product. It's part of waste management in terms of you want the product to be applied correctly to minimize the waste. If you don't apply it correctly, you end up with more waste, and that is one of the strategies. And as it gets to the end of the pipeline, where the product has been used, we now look at the disposal of the waste rinsings, the waste packaging, and any other spillages that may have occurred within the operations. And we look at that and we focus on training users on making sure that they minimize spillages, making sure that whatever containers are utilized, they are collected, triple rinsed, and disposed of appropriately to minimize environmental contamination at the end of the day. You find that if a program is being instituted, you want to make sure that you want to succeed in ensuring that the product is worked well without creating another challenge of waste and environmental contamination. So Syngenta's role here is strategically focused on making sure that the product is used appropriately and effectively, and the disposal of whatever waste comes out of it is also utilized accordingly to better use as well. So the waste management policy then focuses on what do we do with that waste that we collect. We've managed to collect some, so what do we do with it? So we've engaged with various stakeholders in different countries where we roll out programs to recycle or reconstitute that material into other uses, but not uses in the food industry, uses in industries such as waste management, where some empty containers, if they are plastic containers, for instance, they are tele containers, those are recycled and utilized as in the manufacture of waste bins, sewage pipes, electrical conduits, fencing poles, which is a benefit to the program because they can recoup expenses from that to reduce their expenses in the initial outlay of their programs. So you find that Syngenta is heavily involved in that, and we've partnered with a number of players within different regions to make sure that this happens in whatever area we are involved in.
Fantastic. And so, David, how can programs benefit from Syngenta's waste management strategies?
Programs can benefit in all countries that we operate in. We urge programs to engage Syngenta to come up with a particular strategic issues that relate to their waste disposal. And once that waste disposal is collected, we make sure that it is also disposed of through reputable organizations that we have engaged with as stakeholders. We make sure that those reputable organizations account for all the waste that they've collected.
Fantastic. Thank you, David. Now going on to education and community engagement. So community engagement is a key component of IVM. So David, can you explain to us why this is?
Community engagement is a major key issue in terms of our programs. What we've said is within the communities that we operate in, we don't operate in isolation. Whatever programs we institute, they are for the benefit of the community. And as such, we say to ourselves, let's engage our communities. Let's understand their concerns. So Syngenta believes it is important to engage those local communities, work with them. Consequently, it is in our interest to listen to those same local communities in order to respond to their concerns and share knowledge, protect our community environment, our common environment, and promote health and improve their quality of life. So in that regard, we also foster constructive dialogue at community level with both our employees and our communities to make sure that whatever solutions we bring, they are beneficial to those communities. So you'll find that our engagement impacts the community in order to make sure that their needs are also addressed in protecting them against the malaria, in protecting them against adverse environmental impacts that can be caused by use of any of our products. So we minimize the risk and mitigate any possible challenges that may exist to the benefit of the community.
Fantastic. And so what role has Syngenta played to enhance this strategy with reference to malaria interventions?
In particular, with the communities, what we've involved ourselves with active or proactive participation in such programs as the World Malaria Day, the Africa Malaria Day, SADC Malaria Day, such interventions and any other individual programs, like for instance, we actively participating in assisting countries to strategize in their formation of the elimination councils, to make sure that we support those elimination bodies within the programs to the successful implementation of malaria control programs through an IVM approach. And what we also say to ourselves is programs may come up with initiatives to participate in World Malaria Day. And we come in and we support them in terms of production of ICC material or education materials to assist in educating the community. Sometimes we are engaged in producing banners or producing posters to educate the communities where we operate in. And in that way, we feel we put plowing back to the community to the betterment of their health at the end of the day.
Fantastic. Thank you so much for that, David. Now we will move on to the final topic of our discussion, and that's strategic thinking on malaria control in Africa. Just a reminder to the attendees to send questions if they do have any. Thank you for the questions you've sent so far. But yeah, we'll move on first of all to Rose. And so Rose, as we move towards malaria elimination, what is the role of targeted spraying?
Good afternoon, everybody, and thank you for joining the seminar. Just the first thing is we talked about, well, certainly people prior to my discussion have talked about sustainable vector control and optimal use of resources. And to my mind, the use of targeted spraying is one of those. You're all well aware of the fact that in many countries where spraying has been used for a long time, for example, in my own country, South Africa, IRS has been effectively used since 1945. You see that malaria transmission is low but persistent. And it also appears to be in certain areas where it is persistent. And a study was undertaken to see if targeted rather than blanket spraying would be effective in controlling these outbreaks. And in the particular area that was studied in Limpopo province, clusters were randomly assigned to either the targeted or the standard IRS approach. And in the intervention arm of the trial, in other words, where they were just targeting the spraying, the teams only sprayed houses in response to a reported malaria case. and restricted the spraying to just that house, in other words, the index case house, and up to 8 neighboring houses within 200 meters. The targeted intervention therefore involved a substantial reduction in spraying, which means that perhaps money could be used elsewhere for larviciding or other integrated vector management interventions. And it was directed only at the neighborhoods where there had been recent evidence of malaria transmission, as indicated by the occurrence of recent malaria cases. And the studies found that within the pre-specified margin of 1 case per 1,000 people per year, the targeted approach worked just as well as the standard approach. So there are good examples of where targeted spraying works. I know that Chow Chow Malaria is currently undertaking some targeted spraying in Mozambique, and it'll be interesting to see what the results are there. So to my mind, in terms of integrated vector management, targeted spraying is an extremely useful approach, and it allows optimal use of all the resources available to any malaria program. Thank you, Nabia.
Fantastic, thank you. And so Rose, final question. So what is the role of climate change on malaria control?
This is an interesting one because reports differ, or should I say modeling differs, and that depends on the model temperatures and rainfall in areas in Africa. And different reports claim that malaria will spread everywhere, or potentially that it will shrink in distribution. So this begs the question, what should industry and national malaria programs be planning for? I would suggest, and I think Mark certainly would suggest, that there's going to be a probable increase in extreme weather events such as flooding and storms. And we would also suggest that you're going to see increases in the numbers and location of displaced people requiring specific vector control interventions. Now, what do these two things happening require? We believe that it requires a robust supply chain of appropriate vector control interventions as needed. Now, what factors are likely to have the largest impact on malaria in Africa? Urbanization is one. Cities are growing, and we do know that malaria is generally less of a problem in the urban environment when compared to the other vector-borne diseases that are spread by Aedes. And it is probably going to be that these will become a larger problem in the urban areas. Of course, this assumes that Anopheles stephensi does not bring malaria with it into the cities. So what needs to be done? We believe that cities need to plan to build malaria and vector-borne diseases out, particularly when it comes to water management. They also need to plan for changes in climate, extreme weather events taking place, and also they need to take note of and considering mosquitoes and their requirements when they do plan. The other interesting thing to me and to us is that urbanization tends to lead to higher disposable income. This income may be spent on mosquito control, and the urbanization can potentially be impacted by climate change as well. Obviously, with urbanization, we tend to see increases in availability of electricity and mobile communications, which change people's behavior. So what should be done? We believe that one should plan to deliver effective vector control through the private market. The other one that, of course, is of great interest is agriculture and malaria. And we know that climate change may impact malaria, it may impact our agriculture by influencing the crop type and where they are grown, and also impact malaria, especially if irrigated crops are grown. We know that the number of mosquitoes generated in poorly managed paddy rice production is phenomenal. So what needs to be done? We believe that more research should be done into the impact of agriculture on mosquito numbers. So the key messages going forward in terms of strategy, a holistic view of malaria control should be taken, and one should look at the impact of climate change, the impact of urbanization, demographic and behavior changes as discussed. And we believe that it's critical that we look at an integrated systems approach. In other words, what one would term a One Health approach. Thank you, Nabia.
Thank you so much for that, Rose. And our final question in the IVM discussion, this one goes to Mark. So Mark, the WHO recently approved the malaria vaccine. How will that affect malaria control?
Yes, was excellent news, wasn't it? It was very, very encouraging to hear that a couple of months ago. And this is the RTSS vaccine. Whilst it's now approved for use, and it has a great benefit on especially children, it's not 100% effective. And depending on the measures that are used and when these measures are applied, its efficacy is between 30 and 70%, depending on which measure you take. Now, clearly, that's really good news, but it's not 100%. I think that the vaccine should be rolled out where it's appropriate. The WHO has specified areas where it is more appropriate for it to be used, but it doesn't negate the value of vector control. And I think it would be quite a mistake to think that in a region where a large proportion of the children are vaccinated, that you can take our eye off the ball in vector management. So because there are still a large number who will not be fully protected, and of course then there are other people as well who haven't received the vaccine. So it's very good news. In an integrated approach to malaria control, then the vaccines have a great place or role to play in that, along with vector control, along with, as Rose has mentioned, the modification of dwellings, of urban areas to try and build out mosquitoes, build out malaria, and there's a lot of activity looking at that. So yes, it's great news. I think there's still, unfortunately, a lot for vector control to do until we've finally eliminated malaria.
Thank you so much, Mark, and thank you to all of the panelists. That brings end to our discussion. Thank you for the great insight and discussion that you've given us. Let's go to the audience for questions. So I'll just take a look and see. We've got quite a few questions, so thank you so much for everyone who's contributed. Because the first question we've got here is, how can programs adopt the targeted spraying approach? I believe this one can be, this one's for you, Rose, I believe.
Hi, I think that programs can easily adapt the targeted spraying approach, and it's not only adapting it using the example that I have. Within any area that is where they have been using IRS, you will often find a particular area or region where you have the highest number of malaria cases. And I would suggest that it would be a good idea to target that specific area rather than the entire area, and possibly even use it in conjunction with something like larviciding, whereby you set up some sort of cordon sanitaire, or alternatively, and I know there's a question on it in terms of winter larviciding as a core intervention in Southern Africa. I believe that you could use targeted spraying in areas of higher incidence and use a winter larviciding prior to you spraying, so that you can actually drop the numbers of mosquitoes before the start of a malaria season. So I think it's a matter of knowing your areas well and being able to work out a program around that. We can talk about it offline, we can pick it up, they can contact me directly and we can work on it.
Thank you so much for that, Rose. Next question. This one I think is for you, Mark. So what's the major difference between IVM and integrated pest management?
That's a good question. So in one level, there isn't much of a difference, because the concept is the same. You're taking an integrated approach to reduce the number of mosquitoes, to prevent people coming into contact with them, and in an integrated pest management approach, which is often but either in an agricultural context where you're looking to reduce the pest damage of your crop. Again, you look at all aspects there. So you might grow a variety of the crop that's less susceptible, and you might rotate your crops so that you don't build up the population of the pest, etc. So the differences are how you implement it, but the sort of the thought process behind it is the same. It's taking a holistic approach and not just looking at one aspect. So yeah, I hope that's answered that question, addressed that question.
Mark. Next question, what lessons can we take from precision agriculture, i.e. remote sensing, GIS, mobile technology, to re-establish winter larviciding as a core intervention in Southern Africa? I think this might be a question for Kai. If at any point or maybe perhaps Rose can answer this question.
Okay, Michael, I saw your question, and it's an excellent question. And I have to say that I think a lot of lessons can be taken from precision agriculture in terms of remote sensing, GIS, and mobile technology to re-establish winter larviciding. Because I guess we can go back to the famous saying that in the winter season, when it's drier, your water sources are fewer, findable, and much easier to map. And once you've done that, you could potentially even use some sort of remote sensing to search for the presence of larvae. And I believe that it's an underused technology, and we should be using it far more for this particular, to look at particularly winter larviciding.
Perfect. Thank you for that, Rose. So I've got a question here as well regarding the residual efficacy on porous surfaces of Actelic 300 CS. So can anybody who would like to answer this question?
I suggest we ask Mark.
Mark?
Okay. So I'm just going to make sure I get the question correctly then. Whoops. So this is looking at Actelic on a porous surface where it's been observed that there is a decline in activity over time. So first of all, the Actelic meats that we sell today is the same Actelic that passed the HOOPI's approval. It goes through very vigorous quality control, both during production and at the plant, and then it is often once it arrives at its destination, it is often evaluated again to make sure that it meets the target specification. So we can be confident that the Actelic is good quality when you open the bottle of it. So why are we seeing changes over time? Well, the first thing might be that the mosquitoes are becoming less susceptible to permifos methyl. If it's been used in the same location for 7 years, that's a lot of selection pressure on the mosquitoes. And we would recommend using a resistance management approach to try and minimize some of that selection pressure. Another aspect is that we've seen, or rather there have been reports, and these are perhaps not in the sort of scientific literature, but it's what you hear from people, that once you've used a product for a long time, you sort of become used to it working very well. And then you think, well, oh, I can, when I started, I might have been very happy to only see 1 or 2 mosquitoes. Now, well, I'm still seeing 1 or 2 mosquitoes. That's not not quite as I would have hoped. So there's a little aspect there, and that's just in human nature of how we view things. But I think my recommendation would be, if you're seeing a reduction in the performance, the first thing is to check that the susceptibility of the mosquitoes hasn't changed. I would also check that the application was made according to the recommendations, and if the susceptibility hasn't changed and the application has been made according to the recommendations, then it becomes harder to explain, but we will help to in some of these cases where there's an unexplained poor performance. So you can contact Syngenta if this is seen, and we'll help investigate it for you.
Thank you, Mark.
Just to add a bit there, Nabil, I think one of the things which are very important in this particular aspect is when you're using a product is also to try and benchmark its impact from the beginning in terms of the disease, the impact of the disease, and then sort of use those two factors to make your informed judgment at the end of a period. It's also very important. It helps in outlining some of the challenges that you're facing. You may find a product may not be as effective as one may have perceived initially, but you find that the impact is moving in the other direction. The impact is much greater. So you need to evaluate all factors on the ground as well.
Thank you, David and Mark. Hopefully that answered the question. We move on to the next one. This question is for you, David. So what countries have used the waste management strategies that you've spoken of?
Okay, there are a number of countries. I'll highlight 3 countries in particular at this stage. One is Ghana. They've successfully used the waste management practices, recycled the empty bottles by first of all chipping them into chips, and then recycling that or remanufacturing fencing poles, paving slabs, refuse bins, and it's been used very effectively. And that program has been one of the waste management success stories. There's also been in Ethiopia where they are using the same principles, the same strategies, and they are recycling all the empty bottles into electrical conduits. And the demand there is quite huge. In fact, they actually run out of the bottles themselves to recycle, but the success is quite good. It's a very exciting program that they have, which we can share with most of our panelists. We also have had a similar program in Zambia. I'm sure one of our panelists here would also is aware of it, Ruben, where we've also recycled, and there are areas where they are using those as fencing poles and using them as other items for sewage waste or electrical conduits. So the empty bottles have become a big commodity after a program. It's not the intention, but the intention is to dispose of safely and to benefit the program. And I'm only hoping that our programs in these countries have benefited from that recycling process as well, because it's an area that we would also want to follow up to make sure that it's not only benefiting the commercial recipients of the waste, but it's also benefiting the program itself.
Fantastic. Thank you so much for that, David. And now we go to the next question. How can larval source management be made more sustainable under IVM? Maybe that's a question for Kai or David.
Can you say that question again?
So how can larval source management be made more sustainable under IVM?
IVM. Well, if I may start on that one, I think it can be made more sustainable if we can identify, first of all, if the resources are few and findable, and if we're doing it at the right time, and we have a constant record of our activities throughout the program, so that at least when we follow up, we know what we did and what we may need to do in the next year, or what to anticipate in the following year. And also to make sure that whatever we're doing it at the right time during the year, preferably winter larviciding, because larviciding may not be sustainable if it's carried out throughout the year, because there are times when we've got more water bodies, and some of those water bodies are not there for long, and we may end up treating water bodies that may not necessarily benefit the program. So we need to minimize it to the time during the winter larviciding, during the winter period, where the larval sources are few and findable, and also to make it more sustainable, the communities have to be involved, because these breeding sites are within the communities. And if the communities are not involved, the program may not succeed as it is intended to succeed, because you'll find that a lot of successful programs involve the communities in their larval source management.
That's it, thank you. Rose, got a question here for you. So what can programs do to make sure that we can tap into Syngenta's thinking and recommendations on IVM?
Well, I think that each program has to, reach out to the person specific in their area, be it in West Africa, where it would be Hawa, be it in Southern Africa, where it's David, or in East Africa, where it's Peter Mute. And then we can set up a discussion around it and talk specifically on the countries where they are looking at it.
Mm-hmm. Fantastic. Thank you so much for that. Okay, so next question. Okay, so there is an interest in IRS for less permeable emergency shelters of the type distributed by UNHCR. Can Syngenta help extend sprayable services for vector control in humanitarian emergencies?
I'll answer that if you want me to, Nabir. And again, Michael, thank you for that question. We have certainly been looking at it, and I think Kai did allude to the fact that we've now done quite a lot of work on corrugated iron surfaces and had some fantastic results. And Michael, I'd like to take this up with you offline to see what other surfaces you would like us to look at to extend the claims further. But certainly the results we've seen on the corrugated iron surfaces are great. We now know we've gone out to about 8 months with Actelic, and it works exceptionally well.
Thank you, Rose. Thank you. Okay, another question: does Syngenta have an experience of space spraying, and how Syngenta sees the application of spraying? What is the plan of Syngenta in controlling outdoor transmissions?
Can I suggest you ask Mark?
Please, Mark, you can answer that one.
Why is it you always send the difficult questions to me? No, historically, Syngenta has developed products for space spraying. These have been used, and I mean, Actelic as an EC formulation has been used for space spraying historically, as has others based on pyrethroids. I think it's in malaria control, in control of Anopheles species of mosquito, it's really whether it's the most appropriate approach to use or not. And I think there needs to be more research perhaps undertaken into when and in which situations space spraying is effective against Anopheles mosquitoes. Against Aedes mosquitoes, it is used quite a lot, especially if you go to Asia or into Latin America, South America, Central America, it's used quite a lot. But against the Anopheles mosquitoes, historically, it hasn't been done so. But I'm not sure whether there is the research to support that under some circumstances it might be useful. Of course, the challenge always is that it's a very transient approach. So the application is made, the space spray is made, and a sort of a volume of space is controlled of mosquitoes if they're flying around, but then it disperses or falls to the ground. And are there still mosquitoes active in the area? So it's Yeah, I think the question still is, how can it be used most effectively for control of the Anopheles mosquitoes? Now, Syngenta is always looking to always undertaking research and looking to develop new products and new insecticides as well. And that's something that there's actually very few companies, organizations left now that have the sort of research capability to do that. And rest assured that space spraying or sort of area-wide treatment like that is definitely something we think about a lot.
I think thanks again, Mark. Great explanation there. Okay, next question. Can targeted spraying be deployed in areas with a high burden of malaria? And if so, what should be taken into consideration for it to be successful?
My answer to that would be, I think you have to decide whether the high burden of malaria is within an area, is it within a very specific portion of that area, or what I'm trying to say is that when you say an area with a high burden, do you know that that entire area has a high burden, or are you seeing a high burden in an area that is specific to, say, one neighborhood or whatever? If in fact it is specific to one neighborhood, then certainly targeted spraying can be applied and applied very effectively. But again, you would need to look at the kind of the whole malaria, where the malaria cases are, and if they're in a specific area within that thing, then you could do it, yeah.
Thank you. Thanks, Rose. The question, is there any plan replacing already known insecticides with pro-insecticides, such as clonophenaprin or clothianidin?
Well, this could be a question for me, I think. Well, these clothianidin is already in the market. Two products to be used as RS. They are truly plans to use also clonophenaprin as RS molecule, and our company, Syngenta, is not involved in these two molecules. So the answer for Syngenta is clear. No, there is no plan at the moment to replace our pyrimidine by these molecules. Of course, we are looking into other molecules. We are developing further products. We're constantly investing in research. So there will surely be something new, but not these two molecules.
Fantastic. Thank you, Kai. Okay, on our last few questions here. So recently, we've seen the impact of COVID-19 on the supply chain. How has that impacted the cost and access of LLINs? And please tell us how COVID-19 has impacted the implementation of IRS.
I would suggest we ask David to answer that.
When we look at that question, yes, COVID has impacted the supply chain in terms of increasing the costs in transportation. Because with COVID, a lot of our transportation is tended to be affected quite significantly. So in this regard, we've been aging programs to plan way ahead than the normal periods of their planning. Say, for instance, if they were pushing their orders 3 months before the program, we're saying push them to 6 or even 7 months before the program starts, because the supply chain is greatly being affected from the production part of it. In that you'll find that if production is affected by certain employees not coming to work because of the restrictions, and also by the transporters not being able to meet the target because there's so much else to move regarding the COVID commodities. So yes, it has been affected. But as far as the LLINs are concerned, I think I'm sure I may not be geared to answer that question, but I certainly know that as a commodity, it will be affected just the same as other commodities are concerned. And then as far as impacting IRS, COVID has impacted the IRS in terms of implementation in particular, in that where we used to gather our teams as 30 or 40 people, we now have to train them in restricted areas the whole strategy has completely changed. So it has impacted the IRIs, particularly in areas where you'll find that where we don't engage our communities well, that last mile within our IRS programs becomes difficult. So yes, we have had some impact, but I think programs have adjusted well over the countries that I've been or have spoken to. The strategies have been well restructured to meet the challenges of COVID.
Thank you, David. Just one more question for you, David, then. This is does Syngenta develop a mechanism to recycle Actelic 300CS formulation container?
Yes, we do have. I know I see the question has come from Ethiopia. We do have one in Ethiopia, and out of the chat, we can share contact details and the strategies that we've implemented in Ethiopia.
Fantastic. Thank you so much, David. I think just one more came in right at the end here. So logistics have had a major impact on getting insecticides in the country on time. What is Syngenta's strategy to address this? I think we might go back to you again, David, for this one.
I think I'll also ask for us to add on to some points. But what Syngenta has done, like I said earlier on, is to proactively encourage our countries, our different areas where we supply, to strategically plan way ahead from the normal planning schedules. I do have a chart which I've prepared, which assists various programs, which we can share with some of our clients to make sure that they plan at least 9 months before. When they start the program, say for instance for 2021, they should actually be planning for 2022 at the same time, so that at least by the time they finish their 2021 program, they already have 60 to 70% of their possible needs for 2022 and start placing or initiating procurement procedures as early as 9 months before the program starts. Because the challenge is the demands are very heavy on manufacturers, and in that regard, we not only looking at manufacturers, we're also looking at transporters who are facing serious challenges in that some of their fleets are grounded and some of their fleets are not flying in normal routes. So all those issues come in, and we proactively ask our programs to plan way ahead of their normal planning procedures.
Thank you, David. Just a final question to bring the webinar to an end. This one will go to maybe we'll go to Mark, but the other speakers can kind of pitch in on this if they'd like. So Mark, looking forwards, what will Syngenta actually bring to IVM?
That's a good question, and I would suggest we've discussed quite a lot of that already in some of the answers that have been given. But I think on one level, we've said that IVM is about taking a very holistic approach. But to be able to have a holistic approach, you need to have individual tools that you can use as appropriate within your bigger plan, your bigger holistic approach to that. And Syngenta is a company with a very strong heritage in the vector control area. We've been involved with for many years. And even if you go right back to the very early days, it was one of the Syngenta companies that brought DDT to the market. Now, we might have thought differently nowadays about that, but it had a huge impact. And so we have a very long legacy in this area, and we're committed going forward as well. So we undertake a lot of research and development into new products, into both completely novel and new insecticides for the control of mosquitoes, but also for for products for new IRS formulations, or for new ways of controlling mosquitoes that perhaps use more existing insecticides as well. So I think Syngenta can bring its build on its long heritage and its large R&D capabilities. As I already mentioned, there are very few organizations, companies now that have this capability to completely bring a new insecticide to the market. So I think I see Syngenta as both bringing some of the individual tools, but then also we need to promote their use within the holistic approach as well. So I think that's where I would like to see Syngenta in the future and involved in IVM.
Fantastic. Thank you so much for that, Mark. So that was the last question, and that means it's time to draw the webinar to a close. Thank you to all of the speakers for sharing some really great insights into IVM. Really interesting discussion. Thank you so much. A big thank you to the audience for taking the time out today and for asking us some great questions. We hope you've all gained something from today's webinar, and we hope that you've enjoyed it as well. So as a reminder, I will send the recording of this webinar out to all attendees, as well as provide a written Q&A via email. So look out for that. So yeah, once again, thank you very much, everyone. Stay safe, and we will see you soon. Bye for now.